Late Night Health continues with our guest, Jay Faber. He is a medical doctor, a psychiatrist, both a psychiatrist, and a forensic psychiatrist. He's also the author of a book called Escape, and we're going to be talking about rehabbing your brain. Dr. Faber, welcome to Late Night Health.
Thank you, Mark. Good to be here.
What is a forensic psychiatrist?
Yes, a forensic psychiatrist, it basically is a psychiatrist, someone who's been trained to deal with the medical physiological issues of the brain, but in addition to that also helps serve the legal system as a means to either diagnose or treat individuals whose brain health has led to behavioral problems that have got them in trouble with the law.
And they end up incarcerated.
That's correct.
Right. The name of your book is Escape, Rehab Your Brain, but there's also a subtitle to it as well, so that wardens understand that prisoners who are reading the book are not necessarily looking for files or picks and axes to get out, right?
No, exactly. Yeah, I purposely wrote the name Escape down because I thought that would intrigue those who I really want to read it. But when you get into the content of the book, it's all about brain rehab, and it's very challenging, and it will definitely inspire you to live at a higher level.
Is Escape for everybody, or is it specifically for those who are in jail?
It's specifically written for people who have either been involved or currently involved in the legal system. But that being said, I've had family members of individuals who have their significant others incarcerated, and they found the book to be quite helpful as well for themselves.
How did you get involved in this? I know that in terms of addiction right now, in talking with doctors and rehab counselors over the last couple of years, right now heroin seems to be the drug of choice. It's easily available, it's cheap, and it's cheaper than, say, OxyContin, a pharmaceutical, which boggles my mind somehow. It just does. Would you agree with that assessment?
Well, yeah. I mean, just if you look historically what's gone on, a lot of the medical boards have started to demonstrate increased scrutiny, and I think understandably so, to physicians for prescribing pain pills. And so a lot of individuals who've been getting their, for lack of better words, fix from OxyContin, Vicodin, etc., have changed over to heroin to keep their habit going. So there's the cost price, but there's also just availability. And for some, it's easier to get heroin now, believe it or not, than it is pain pills.
Well, here in California, a physician recently was sentenced to, 20 years, I think, in prison for over-prescribing opiates, and which is what people are given when they have, tremendous pain.
Yeah, I mean, it doesn't surprise me, if you go to most of the state medical board bulletins where they talk about physicians being disciplined, over the last 5 years, there's been a much, much higher percentage of disciplinary actions for physicians prescribing pain medications inappropriately. And then you look what happened to Prince. I mean,
I was just going to say that.
Accentuates it even more.
Well, and Michael Jackson.
Michael Jackson, yep.
Right? It's kind of the same thing, and it goes on and on. If somebody has, as a doctor, as a psychiatrist, as a human being, you don't want to see somebody in pain. But some of the drugs are so addictive. Is that part of the problem?
Yeah, and especially for a certain group of people. I do at my clinic a lot of SPECT scans. We look at functional blood flow and can get a better understanding about how the brain is working or maybe not working so well.
In other words, you can take a scan of my brain and let me know if I have an addictive personality?
Well, we can look and say that you would have a higher propensity depending on which parts of your brain are either overworking or underworking.
Wow.
Yeah. I mean, I'll give you an example. This was when I was back working in Texas. A gal broke her leg, nurse, who was a fairly high executive in a hospital. I won't say what level, but like way up. But she said, Dr. Faber or Jay, I broke my leg and they gave me some Darvons to take. And after 3 days, I couldn't take them anymore. I said, well, what do you mean? And she says, because of the emotional effect they were having me. I was afraid I'd get hooked.
Huh.
And so some people, there's a part of our brain called the basal ganglia. It's one area. If it's overworking, people have a tendency to want to use alcohol, marijuana, or pain pills to calm it down. And the scary part is it works. The problem is those meds are addictive, and we're finding out they're also toxic to your whole cerebral cortex.
Well, things like OxyContin, which apparently is very addictive. It does stop the pain, but people are buying. We're buying it. Black market in shopping in market shopping parking lots. That was a few years ago, but that it was readily available but expensive, and now they're using heroin instead. Do we still have, in your opinion, a drug epidemic in the U.S.?
Well, yes, and I would put an exclamation point after that. People, our brains, they know what helps them calm down. And unfortunately, substances like alcohol, opiates, marijuana, etc., can do it. The sad part is these people don't know there's there's other things you can use that are actually quite healthy and not without the addictive ramifications that go along with it. But you have to go see somebody who understands those physiologies to get you the things you need.
And your clinic, you run the Southern California Amen Clinic, I believe.
Well, yeah, I work at the Amen Clinic. Dr. Daniel Amen's the founder. He's been doing SPECT scans for the last 25 years. We've got about 120,000 scans now. So all those scans are interestingly kept in electronic data warehouse banks. So Dr. Amen's used those as data to figure out where brains are overworking and underworking over the years to know how to help brains work at their optimal level. So optimal level basically means, in what we're talking about now, hey, there's other things we can give your brain to help it function better so you don't have to go out on the streets and buy heroin, use pain pills, pot, or other things that are going to get you in all sorts of legal trouble.
And at the same time, isn't one of the best things to do to get your brain in shape is to just exercise and go for a walk?
Well, there's an interesting concept. To answer your question, yes, definitely true. And we're finding out that just as you go to the gym and take your, protein shakes, your creatinine, etc., exercise actually helps the brain, and there's probably other supplements as well, and probably light word, there is other supplements that can help your brain function at a higher level and be more healthy.
And that's a good thing. A lot of the people who are incarcerated are there because of drugs. They steal, they commit murder, all to get their fix. Would that be an accurate statement?
Yeah, depending on who you read, about 75% of people involved in the legal system, incarcerated, are or have had some kind of substance abuse history. So, yeah, they get desperate, and when people are desperate, they do
desperate things.
Crazy things, yeah.
Would you be in favor of legalizing some of the drugs that are being used, or not?
Well, yeah, that's an interesting, question. I mean,
it would put you out of. It might put you out of business.
Well, either that, or it might give us more business, depending on who you talk with. But if you look at some of the research that's starting to come out, like with I guess cannabis would probably be the biggest one we're seeing. more legalization of. Yeah, it does calm down your basal ganglia, but simultaneously, we're also seeing that it's toxic to your cortex. And so, short term, you get calm, but long term, you tend to think slower. You tend to use poor judgment, and that's not such a great thing. I mean, if you go back, and I think we can all think of people in our high schools or maybe even earlier who were quote unquote potheads, and kind of all the ways they spoke and thought and behaved. I mean, that's sort of the more toxic effects we're seeing.
Joy had a question for you, Doctor.
Yeah. At what age can you start doing these scans to really be able to tell, if they're going to have issues?
Yeah, we start scans here. We age 5 and above.
So do those younger kids, they start going through therapy to change the way they think, or, how does that work?
Yeah, some do. It really depends on what they're coming in for. Now, a lot of 5-year-olds come in because they're not focusing well. I'd say a larger percent of those kids have been on stimulants, and they haven't had such a favorable response with them.
There's something like ADHD and Ritalin and things like that.
Yeah. So if you've got like frontal lobe problems, Ritalin stimulants work real well. The problem is we're starting to find there's other parts of your brain that either overwork or underwork that cause focusing problems as well. So, for example, if your temporal lobes aren't functioning well, you tend to get more frustrated and irritable. So if you're studying, and when you study, that's stress, you tend to get more irritable, and these kids with temporal lobe problems get really irritable. You can't focus as well. So you give them a stimulant, and it'll stimulate your frontal lobes, but guess what else it stimulates? Your temporal lobes, and then these kids get even more angry. And so you have to take a different approach depending on what part of the brain is not working as well as it should.
Can you predict from these scans, and we only have a minute or so left, can you predict from these scans if you have a young child who may have been diagnosed with ADHD, 5, 6, 7, 10-year-old kid, that they may have a problem later in life with drugs?
Well, yeah. I mean, like we were talking about basal ganglia earlier. So, one of the things, as soon as I see those lit up, you have a conversation with the parents. We need to watch closely when your kid turns age 14, 15, because guess what? They're going to go out and try to find things possibly that calm this part of your brain down.
Amazing. We're going to have, Dr. Faber doesn't know this, but he's coming back in about 3 weeks on the show, and we'll spend some more time with him. We ran out of time today, but I want to come back and spend some more time. Go on our website. You'll be able to see a picture of Dr. Faber, as well as a link to his book, Escape, Rehab Your Brain. And it's a book that, while specifically designed for people in prison, I think can help everybody in general, think better. Coming up next, Robert Clancy will be joining us, the author of The Hitchhiker's Guide to the Soul. Dr. Faber, hold on a second. All right, Late Night Health continues. Don't go away. More coming up.